Representative Robert Bierman has just joined us. Representative Bierman is the new chair of the House Health and Human Services Finance and Policy Committee. Okay, take the mic.
Well, this is exciting. Can you hear me okay?
Oh, not too well.
Not too well? I can bend down. Okay, my name's Robert Bierman. I am the co-chair at this point of the Health, Finance, and Policy Committee. And welcome you all to the Capitol. We need you here and we need your voices, for sure. I am in league with you. And backup voices are incredibly effective and helpful because there's a lot of education with this. And I think my challenge in the 8 years I've been up here, wanting to change our healthcare system, as I go through policy year after year, and now as a chair, we are building a healthcare system where the bills we pass are like addendums onto the existing structure, and we're helping one small group of people at a time. We haven't answered that fundamental question of Uwe Reichert, who said, first you have to decide what kind of healthcare system you want. And I know the people in this room, his fundamental question he always said was, does a child from a poor family deserve the same health care as a child from a rich family? And if you answer that question in the affirmative, that is where you should be starting to build your healthcare system from. And that's not what we have. We have a mishmash, we have a broken, fragmented healthcare system that needs work across the board, and the easiest thing would be to establish a new system. In 2023, we were able to get a bill passed finally to look at our healthcare system in a new way and say, what are some other models that we could use here in Minnesota? And it took 5 years of me and the legislature to get that bill to pass. We had to have a trifecta to do it, and it was only a study. And it is only coming out this year. I was hoping it would be out in time for a full hearing. It sounds like it won't be out complete until summer, but we are working on getting sort of an outline to have an informational hearing yet this session, because we need to talk about this. We need to have full-on conversations, the entire body wide, to talk about what would be better. How much money would we save if we started from scratch with a new system? And what would that new system look like? And who would it be helping? And fundamentally, yes, healthcare for all and addressing all the needs of people and eliminating and moving away from this system that first takes it into consideration who you work for and what your zip code is. And then that determines your price. So we need to do fundamental change in that regard. We are going to have a hearing. It's will be out, House File 255 will be heard next Monday is our current plan. So if you can be back up to the Capitol for that hearing and support Chair Liebling with that bill, that would be a good idea. That's the patient-centered care bill that we want to, again, give it some air and life and start to have conversations about it. So I'm excited that this year we're going to have more of those in-depth conversations and look at a system that will begin by taking for-profit companies out of the public programs. That's a good step forward. Will give us some better insight into where all the money is going, and looking at the Connecticut model as a model that we could emulate here in this state, and that is very doable. So this bill will be up for discussion Monday, and would love to have your help and support on that. 1 p.m. 1 p.m.
On Monday.
On Monday.
16th.
On the 16th, yes. So that's probably the cutting edge news, but just appreciate all of you being up here and happy to take any questions you might have as you're going about this business. I know many of you have been involved in this for a very long time, and always want to hear from you if you're willing to reach out to me directly and give me suggestions. And let's have some questions.
What kind of messaging can we get? What's the best messaging for trying to get people on board who are opposed, particularly from greater Minnesota?
I think it's a step-by-step process, and that's why I'm happy to have this bill coming up on Monday, because in the greater Minnesota areas that have county-based purchasing, there are many Republicans, including my co-chair, Representative Backer, who favors the county-based purchasing, which is a closer to the point of delivery care and administered by the counties themselves. So he favors that system, which is wonderful. And that's sort of a model that if we could expand it and move to that across the state, that would be helpful. So I think just talking to people about the challenges that they face with healthcare, that's obviously the one of the key things. Also with certain, you have to know kind of who you're talking to and what their background is and how much they really care about the issue. I like to believe that anybody serving on our Health, Finance, and Policy cares about helping people get coverage that is affordable and usable and accessible. And but there are some members who are, they're pretty quiet and they don't really bring bills, and they sometimes just show up to stop whatever we're trying to do as far as moving to a system that takes away something from insurance companies. There are a lot of members who fully support insurance companies and whatever they want to do because they know the business, is what you hear from them. So you really have to just, advocate based on who you're talking to and try to find out what their concerns are and work from there. Very much like door knocking. You don't know what you're going to get until they say hello.
And health insurance is not health care.
Right. That is a...
Insurance is not health care.
Thank you.
We can help them understand that.
We can, indeed. That's a very good line.
How do we counter people who think that all the fraud with DHS, and the bill says DHS will assign somebody to make sure there's no fraud, versus these private companies that are a closed book and we can't see where the money has gone and what have they done? Yes, insurance companies are supposed to be in the business of doing this, but they don't share what they're doing.
I live that life. I've been trying to get information from insurance companies about, they come in my office and they say, one of the good things about us is we have a capitated rate and we are responsible if there is fraud. We lose the money, not the state. And yet, I say, show me. Show me an example. What happens when you lose the money and it goes out the door, and as a business entity, you apply it as a loss, but the following year you raise your rates to accommodate for the higher cost you just paid. So show me where you're reducing the fraud and how. And this has been months long trying to get information from them. They eventually turned me back to DHS and said, well, they have the information, we can't provide it to you. So now I'm talking to DHS, and they do have a report that's out, but I haven't got the report yet. So to your point though, there is no sight line from the state into these organizations to know precisely. And that's a huge, huge part of the problem. And if you look at the Connecticut model, how they saved $4.5 billion, it was because they eliminated those MCOs. The cost of the care, the administrative cost, which is anywhere from 16 to 32%, is a big savings right there. Someone else had a hand.
Small businesses have to provide insurance, and it's a real burden to them to have to negotiate insurance policies most of the time, they don't fully understand them. It would be a huge advantage to the small business community to have health care for all or some kind of a Medicare for all program. Is there any outreach to the small business community?
So he's talking about small businesses and the expense of that for small businesses. They are negotiating on their own, basically. So small businesses pay some of the highest rates that is in insurance. And it is extremely difficult. You are talking to a small businessman. I mean, I have 12 to 16 employees. That was the one thing I never wanted to do in my business, was negotiate and follow the healthcare thing, because it was time consuming, and I was in I was trying to make sales and move my business forward, and so I assigned someone to that and never really got involved in it until I got elected. And then I said, okay, this is really a problem. And, you know, to talk to people who are from other countries where they have a system of healthcare that is not based on where you work, there is such freedom for people to be able to go about their lives and do what they love doing, rather than being tied to a job that they can't quit because they'll lose their health insurance. And the cost only goes in one direction. As a small business owner, it was so frustrating. I mean, many, many years, the cost of our health insurance was higher than what I could pay people in raises. And I felt horrible about that. And we used to have, when I first started, you know, we covered health insurance, 100%. Nowadays, it's more like 50%.
Yes,
So,
us.
Yes.
We are the outreach to small
To
businesses.
small business.
Please, we are actively building a coalition. We're not, this room is not going to get the Minnesota Health Plan or the Pension Center Care Direct Payment Bill. Ken Engelhardt right there, we are working on bringing together organizations of, you know, groups of like-minded people. Anybody you know who is either an individual or a group, please have them just get on our mailing list and contact our organization.
so it is very much grassroots, and you can work with local chambers with that, but once you get to state level chamber, it's all about the insurance companies.
Yeah, sure.
Well, they have the money and the power and the lobbyists.
Couple of things, thank you for being here.
Yes.
Last year, I attended a Women in Agriculture Day on the Hill that was organized by Senator Kunish. And there were some women who came to that, who live in rural counties, who described not only their challenges with getting childcare, but also huge issues with health care because of the accessibility or lack of that. And it occurred to me that their testimony would be really helpful for what you're doing, because the people that are their representatives are typically Republicans. And so that was one thing. You mentioned the county system that's being used. Maybe describing that and getting people to understand what that is would really help the Republican representatives. My guess is that a lot of them don't even understand that that's how it works in some of these counties and how effective it is. And finally, just for general information, in 2003, a group of us organized Parents United for Public Schools, and one of the things we discovered was that a quarter of all of the money, per pupil money from the state, was going to insurance premiums for employees of all the school districts. A quarter of that's per pupil money. So what does that tell you? And every year the insurance premiums were going up, just like you talked about. If we can get this kind of legislation passed, so that our school districts are not having to, and this is all across the state, deal with that issue of having to deal with healthcare premiums. Think of all the money that goes into your schools then. If that isn't a talking point to Republican legislators, I don't know what is. All of their schools are suffering because of this.
Agreed.
So,
No, I agree. And a lot of your points, when I go to meet with the Farm Bureau, for instance, you know, I screen every year with them. It's amazing to me how easy it is to talk to that community about the issues that are important to them, because healthcare, childcare, education for their children. I mean, those three things are what we talk about. We have so much in common with the rural communities. And we did a meeting of around a series of cities the finance committee did. Rep. Purcell arranged it all, and we went to Winona, St. Peter, up near St. Cloud, and Red Wing. We had groups of people coming telling their stories about their difficulty with healthcare, and a lot of them were farmers, and that was the main focus of their.
And these stories are old and
Oh, yeah.
enduring. So, like, this is the solution.
This is the solution.
Thank you.
Can you talk about county-based purchasing a little bit?
County-based purchasing essentially is fee-for-service. So instead of MCO control, and then it has at the county level, like an ASO, Administrative Service Organization, or reliance on county employees who help coordinate the care through a primary doctor and facilitate those other things that managed care is supposed to do. And their rate is far less. You know, you're looking at 1.5% to 2%. So that's the savings, and it's basically a fee-for-service model administered by the county, and sometimes the county acts as that administrative service organization, and sometimes they hire out parts of that. So quality of care and the coverage and the coordination of care, these county-based purchasing systems that do it, they are extolling their virtues and they invite others to follow them. So that's kind of how it is.
What
Which
percentage? Yeah, right.
Which
That's
counties are doing that?
So there's, I believe, 26 counties involved in 3 separate systems. Itasca County is all by themselves, and they're one of the oldest. They go way back decades and decades where they've been doing this. And then the other ones, there's one right up to the western edge of Minneapolis, which is about, I think, 14 or 16 counties. And so counties can opt in, and I think we're going to have more interest in it with the the county-based purchasing bill we passed recently to sort of help them update their system.
This, or are you talking about supplies and things like that, or are you talking about the whole healthcare system? I mean, are they paying hospitals and clinics, or are they helping to get that?
So the ultimate payer is DHS, and the county-based system is the model that care would go through for primary care and for Medicaid. So it's not, if they're referred to a hospital, that's a little bit different.
Thank you. I was going to ask you to describe the county-based, and I was a medical director at Medica, and one of the reasons county-based purchasing is out there is because it wasn't profitable for the insurance companies to do this work there. And I don't say that in a degrading way. We're a nation of business-oriented. That's how we function, but that's why we need a different system. And so, yes. But it's still fee-for-service, and you did start at a point saying we want to be somewhere elsewhere, but it's a stepwise process.
It is a stepwise process. Yeah. And then what we've added now is to not permit MCOs to get their foot in the door anymore.
For the county-based.
For the county-based.
So
We have 2 over there.
So from the patient side, how does that work? Does the patient pay monthly premiums? What about deductibles and co-pays? And then who
This
pays
is
their
the
medical
public-
bills? How does that work from the patient side for county-based purchasing?
It's a public program, so the Medicaid services. That's what it covers.
Would it be possible, so I'm looking at the patient-centered care sheet that we have, where it says that the state could run these programs. Would it be wise to make it all at a county level? Would people see that as more advantageous?
Well, that's essentially what we're we're trying to do the bill so that we can get the counties to come on board and do it as a state system, but not necessarily always specific on the county, because we need buy-in for that. And this is going to be a process of convincing a lot of counties that have been MCO 85% for quite some time, and they just can't understand how that system would transfer and how that would work. So that's where we'd like to get to with this program and make it all DHS based. The county based systems that are intact, functioning, we don't want to disrupt them. So we're going to keep what we have with the county based. Counties could opt in. That's in the bill. So we want to make that happen. One more question, and then I do have to, my LA is in charge of me.
Hi, my name is Norma Anderson. I happen to be an insurance agent. However, I was wondering, are you seeking to get a contract directly with CMS, the Centers for Medicare Services? So then that way you have complete control over how the funds that they use per each Medicare beneficiary to be able to use it to fund your program.
We would need to get a waiver from CMS, I'm sure of that. And how long that process would take, I'm not sure. Usually CMS waivers can take 1 year to 2 years to obtain. So but there is a need for that. And in the longer term, as I'm looking ahead to what a universal care system would look like in Minnesota that is in the new report completely redesigned and eliminates all networks and becomes a system where it's one system, we would need a waiver for that as well, because then we would want all the advantages of the per patient Medicaid services to be covered, obviously, and there's be a lot of federal work to do on that. But that's how Canada got there. It was one province, and then it expanded, and it took a decade or two. But there's no reason we can't get to that system when people realize the savings to be had, and then just all the relief for businesses. I mean, businesses say, well, we would never want that. We have our own system. And I say it's like paid family medical leave. If you're doing all the things for paid family medical leave and you want to keep doing them, great. You don't have to join. If you want to continue your health care coverage in your own business the way you're doing it through your ERISA plan, great. You keep doing it. You're still going to get taxed by the state, though, for the coverage for the rest of us. And then they're going to have to choose. That's the way Senator Marty drew the plan.
Well, then, just one other comment. You're talking about cost benefit, but we also need to bring up the benefit to us as patients, as the clients, and how much better our care will be.
Thank you.
Not just the cost.
Well, I mean, I start with the cost, but you are spot on. It is about quality outcomes. Number one. That's why we would do it. Thank you all for your work. Appreciate it very much. Thank you.